When you hear the word banana, what do you think of? In the past 3 months, every banana you've eaten has been an exact clone of another. Years ago, scientists selectively bred the perfect banana, one that is seedless, sturdy, and of course, one that tastes good. We don't think of bananas as unnatural or dangerous, yet their genetics are more controlled than almost any other food in the world. So what actually makes a food genetically modified? Almost everything we eat already is. Farming techniques that have been used for decades, like cloning, selective breeding, cross-pollinations, are all technically types of genetic modification. But when someone says genetically modified, they often mean something very specific. The intentional altering of DNA by changing a single base pair, inserting a region, or deleting a segment. This practice is seen as artificial and dangerous, while modern techniques are viewed as safer and more natural. But let's take a step back for a second. One technique intentionally alters genetic information to produce a desired trait. The other intentionally places branches of the same species near each other, hoping they'll exchange genetic information and produce a desired trait. Different methodology, but the same goal, the same outcome. And that difference in perception doesn't just exist in the definitions. It shows up on our plates. In the past 5 years, I've probably eaten around 300 bananas, just like many of you. And despite what the headlines or common media may suggest, I'm completely fine. No cancer diagnosis, no superpowers, no second head, just a banana. I stand here today as proof of the good GMOs can do, lowering food costs and increasing production yields. Coming from a family that relied on SNAP benefits, I've seen firsthand how invaluable this impact can be. Grocery shopping wasn't about preference. It was stretching meals, comparing price per ounce, and knowing that whatever went into the cart had to last. Those experiences taught me to think differently of food, something that should be affordable, accessible, and reliable. This isn't just an academic debate for me. It's something I've researched and something I've lived. I understand the science, and I understand what's at stake. Humans have been shaping the DNA of our crops and organisms for thousands of years, long before labs or microscopes existed. So the term GMO can be misleading. What most people fear are genetically engineered organisms, a specific type of GMO created using modern biotechnology. But the name isn't the only thing people get wrong. Much of the debate within the scientific community has been resolved, but it often still feels like a controversy because the media presents it that way. We fear what we don't understand. And today, I hope to alleviate some of that fear by addressing the most common misconceptions about GMOs. There are thousands of myths circulating about them, from claims that they are inherently toxic to beliefs that they are damage to the environment. Views such as these are not only unsupported by scientific evidence, but also risk reinforcing classist and elitist ideals towards food. Such claims often assume that people have the financial means to avoid genetically modified products, instead purchasing more expensive, organic, or non-GMO alternatives. In this sense, food can become a status symbol, dividing those who have the money and the means to purchase $20 smoothies from those simply hoping to make an $100 grocery budget last throughout the week. This framing subtly moralizes food choices, casting reliance on affordable, widely available products as careless or irresponsible, rather than acknowledging the realities that shape dietary options. As a result, anti-GMO rhetoric can often shift attention away from conversations of food access and availability, instead placing undue blame on individuals for choices largely determined by income and affordability. Decades of research has consistently concluded that GMOs pose no threat to human health. A literature review conducted by Jose Domingo in 2017 states that genetically modified foods have been consumed by millions across the globe, and to date, no toxicity has been reported clinically, scientifically, or legally. No credible link has been found between GMO consumption and the health risks that many often cite. One study even compared long-term health trends in North America, where GMO crops are widely consumed, to those in Europe, where their cultivation is rare. These comparisons serve as long-term observational studies, and no differences were found in rates of cancer, obesity, diabetes, or food allergies. Another common fear is the loss of biodiversity. In relation to this point, it's important to acknowledge that we've been reducing biodiversity for years through selective breeding, long before genetic engineering existed. By choosing the highest yield crops and breeding only from a select few, we narrowed the genetic pool ourselves. If biodiversity loss alone were enough to cause an agricultural collapse, we would have seen the effects long before GMOs entered the picture. These concerns deserve attention, but they should be rooted in scientific evidence, and the evidence is strikingly consistent. GMOs show no inherent threat to the environment. In fact, in many cases, they have been shown to have a positive impact. Another study states that farms that produce genetically modified crops show reductions in pesticide usage and overall improved soil health. When cultivated according to the established management protocols, GMOs are not a threat to ecosystem integrity or biodiversity conservation. Although increased herbicide usage has been reported, the EPA ensures that levels are safe for consumers up to the established tolerances. Despite the strong scientific consensus on their environmental safety, public concern surrounding GMOs remains widespread, largely due to the persistence of misinformation. When misinformation goes unchallenged, fear can end up shaping decision-making more than scientific evidence. In a survey study, Claire Maris compared the general public's attitudes and beliefs about GMOs, finding that many respondents viewed them as unnatural and were unsure about the technical distinction between conventional breeding methods and recombinant DNA ones. These misconceptions are not confined to public opinion, as scientific and political debate can influence legislation and prevent the spread of GMO cultivation. In reality, although the processes differ, the resultant organisms are the same. Both selective breeding and direct genetic modification alter plant genomes, with genetic modification simply being a more modern technique that saves time, resources, and labor by several orders of magnitude. This gap between public perception and scientific reality highlights how unchallenged misinformation fuels unnecessary fear and influences public attitude towards GMOs. In addition, many scientific articles written against GMOs have since been peer-reviewed and later found to rely on flawed methodologies and insufficient data. One of the most frequently cited examples is a 2012 study by Giles Eric Seralini that compared tumor growth rates in rats fed genetically modified corn to those fed non-modified corn, and has continued to be used as a cornerstone of anti-GMO arguments. However, this study has been widely discredited within the scientific community due to several major flaws in its design, execution, and analysis. The study used an extremely small sample size of Sprague Dawley rats, which are genetically predisposed to tumor growth rates as they age, regardless of diet, making them unsuitable for a long-term cancer study without the presence of large control groups, thus making the observed trend of increased tumor growth scientifically unreliable. Because these limitations were not properly accounted for, the study's conclusions were deemed inconclusive and misleading, ultimately leading to its retraction in 2013. Despite this, it has continued to be used in anti-GMO rhetoric, illustrating how flawed research can persist in public discourse and fuel misinformation even after it has been thoroughly challenged by scientific evidence. Something that compounds this issue is the abundance of websites and articles online that advance claims about GMOs without credible scientific evidence. While doing research on this topic, I found that sponsored search results on Google frequently promoted anti-GMO rhetoric rooted in misleading or false assertions. Although these websites often appear authoritative and professionally designed, they commonly rely on selective evidence or outright inaccuracies. One thing many of these websites have in common is their claim that genetically modified foods are inadequately labeled or entirely unregulated. However, the USDA states the conditions for the labeling of food containing GMOs. You will see words, a symbol, scannable link, text message instructions, or in some cases, phone numbers or web addresses that convey the information. To verify this claim, I examined product labels at a local grocery store and found that many foods clearly disclose the presence of genetically modified ingredients, often directly on the packaging or through QR codes consistent with USDA guidelines. Websites that peddle false information like this contribute to public fear by fostering the perception that scientists and regulatory institutions are untrustworthy. What people hear far less about are the ways that GMOs are already improving lives, especially in the fight against global hunger. From flood-tolerant rice helping farmers combat climate change, to insect-resistant eggplants reducing pesticide usage in the Philippines. And finally, golden rice reducing the effects of vitamin A deficiencies in South Asia. In many developing countries, vitamin A deficiencies are widespread due to food insecurity and limited nutrition education. This deficiency is especially devastating for children, as lack of vitamin A can cause blindness and weaken the immune system, increasing the dangers of infectious diseases. A 2023 meta-analysis of observational studies estimated that 330 million children and adolescents were affected by vitamin A deficiencies in 2019, with numbers steadily rising. To address this, scientists developed golden rice, a genetically modified crop that produces beta-carotene, a precursor to vitamin A. And because rice is already a stable crop in regions where these deficiencies are common, scientists were able to guarantee its production and consistent yields. It's already been approved for use in the Philippines, where 1 in 5 children suffers from health issues caused by vitamin A deficiencies. However, the Philippines remains the only country to approve its cultivation thus far. Public misunderstanding is hindering legislation to approve GMO cultivation in other countries, leaving millions to suffer from a deficiency we already know how to prevent. But this is just one story, and there are hundreds more just like it. Stories of life-saving technology being withheld not because it is dangerous, but because it is misunderstood. Right now, conversations around genetically modified products matter more than ever. Around the world, millions of people are experiencing food insecurity, from families in the US losing access to SNAP benefits, to communities in Gaza, Sudan, and Haiti facing extreme crisis. For me, this isn't an abstract policy debate. I think back to my own family and our experiences with food insecurity. Technologies that increase food production and lower costs don't just improve efficiency, they change what's possible for families like mine. At the start of this talk, I asked you to think about a banana. Not because it's remarkable, but because it isn't. It's familiar, trusted. We barely think twice before peeling one open. Yet its genetics are more controlled than almost any other food in the world. Organic foods aren't inherently superior to those we already know and trust. What we fear isn't the science itself, but the stories we've been told about it. Food deserts are expanding. Climate change is disrupting crops, and according to the UN, over 720 million people are facing acute hunger worldwide. In times like this, we need to seriously consider every tool that we have to produce food that is affordable, accessible, and reliable. GMOs are not a threat to humanity. Hunger is. Fear is. Misinformation is. With proper research and guidelines, GMOs are tools that can help us change lives. The question now is whether we'll choose to use them. We can fear the future, or we can engineer it. Thank you.